One thing that your resistance training program may be missing is a tissue hygiene component. And what we mean by that is your muscle, because of sitting, because of repetitive movements, because of stress, and a bunch of other things, poor posture, it gets tight and it gets a bunch of knots in it and it gets a lot of little trigger points in it. And we've all kind of experienced that. If you get a massage or you go to physical therapy, the therapist will get in there and they'll find a really tight spot and they'll hold on it, and then the muscle will release and that tight spot goes away. And if you don't have a massage therapist or a chiropractor or someone who's trained to do this, you can do it yourself. And the reason why you want to do it is because if you have that tight spot or tight muscles or those trigger points in your muscles won't be working as efficiently. And then you end up with bad movement patterns, poor alignment, and then that'll lead to inefficient movement patterns or decreased force output. And all the things that you're doing the resistance training program for, it'll make it less effective. Another reason why we want you to do your tissue hygiene work is because if you have those knots or those tender points in your muscles, no amount of stretching will get them out. We have this at the very beginning of our workout or our resistance training program. It's not resistance training in a traditional sense, but with all training at high levels, we always put this in. Even at low levels, this is the first thing that your program should start with. So we'll show you how to do some of those exercises right now, but what we'd like to say is that if you do find a tight muscle or trigger point, a really small little tiny spot, we want you to hold on there for 5 to 30 seconds and maybe do anywhere from 5 to 30 sweeps. But be aware of your breathing. If your breathing is labored or you're holding your breath, work on trying to find that happy place and really just work on your breathing and slow it down and tell your brain to chill, and your muscle will chill hopefully in response to that. So those are just some of the reasons why we feel that the foam roll or the self-myofacial release are important for any resistance training program, because we're really trying to clean that tissue up. Try to maintain a straight line from your heel to the back of your head. Don't pike your body as you're doing this. And try to work up into even doing your two legs stacked on top of each other. Maintain a tall, neutral spine and work on your breathing while you're doing these exercises. Keep the body from dropping down. Push the shoulder blades apart and keep your body as straight as you can while you're doing this. You can also move towards the outside or the lateral quad to try to find some trigger points. Slowly roll and work on your breathing as you're doing these exercises. For your left adductor, have your body at 12 o'clock and the foam roller at 10 o'clock. Do the same thing on your right, but have the foam roller at 2 o'clock. Try to not let the shoulders come together, push them apart, and maintain a level pelvis while you're doing this exercise. You can even try to keep the heel as close to the floor as possible. Do the full length of the muscle. Melt your body over the foam roll and make sure you don't go lower than the bottom of your shoulder blades. Keep your butt on the floor while you're doing this exercise, and don't let your chin poke forward. Place the foam roller underneath your armpit and do short, tiny strokes. You can move your body forwards or backwards to try to find the trigger points in your lats. Make sure that you don't go too far down on your rib cage or you will jam a rib. Roll on the meaty part of your glute. Make sure you don't roll on the bone of your hip. You can also increase the tension by putting your foot on the opposite thigh. If you get any numbness or pain, stop immediately. There are three main parts to this calf that gets tight, so try to get the outside, the inside, and the middle of your calf while you're doing this exercise. Another valuable tool that you can use is a stick. You can do your TFL, which gets tight from sitting. You could also roll it down even farther on your quad on the lateral side. Get your glute and also QL, or low back area, often gets tight. And then you could also do the foot. Make sure you get on the outside of the foot and go the full length from the outside, middle, your plantar fascia, and then all the way on the arch too. That gets tight. When you're doing your calves, try to relax the calf, get the outside, middle, and inside of your calf. Good luck. Keep practicing and you can do it. If you have any questions or need any help, please give us an email or check us out at mywellnessmechanics.com. Thank you.